Our hospitals are sounding the alarm again. The Delta variant sending a record number of kids to the hospital. We're going to bring in health and wellness reporter Sonia Azad to show us what's happening and why this looks different. Sonia.
Yeah, Kara, so at least 2 local children's hospitals are seeing record numbers of pediatric COVID patients. We've got Children's Health reporting 60 kids hospitalized with COVID right now. Cook Children's has 35. So we got a new look inside the latest COVID unit at Cook Children's. This is the 3rd they've open to meet demand, and in 24 hours it was full. So why is this happening? Well, there are a lot of factors to consider. This Delta variant has been a game changer. It's impacting young people differently than the original strain that we were dealing with last year. These pediatric ICUs are also short-staffed, and of course we've got a more open society, right? Schools are in session, which is good, but not everyone's wearing masks while indoors, which makes it easier for viruses to spread.
The Delta variant changed everything. Like, Delta loves kids. We're physically unable to care for kids in a timely fashion.
The medical director for urgent care services is reiterating parents, if your child has been exposed to COVID or if they test positive and even if they have symptoms, they do not need to be rushed to the emergency room.
Yeah, Sonia, as a parent, what symptoms should we be on the lookout for? I know my kids have been dealing with runny noses and coughs, the kind of stuff that you might normally associate with a cold, but now you're kind of asking, what should you be looking for?
Yeah, and I asked doctors this. I've asked them several times, when should you get tested? When should you get your child tested? And basically they said, look, if you're thinking about it, get tested. If your child is experiencing low-grade fever, dry cough, headache, sore throat, loss of taste or smell, mild aches, diarrhea, or other digestive distress, and yes, those are symptoms of COVID, call their pediatrician. You're going to have to manage their symptoms at home. I would not let them play with friends or heavily interact with the rest of the family and siblings because you, of course, don't want to spread it to anyone else, especially anyone who's unvaccinated or immunocompromised. They need to go to the emergency room if column B, right? That blue square on your screen. They're having difficulty breathing, chest pain, if their face or lips are turning blue, if they're disoriented or unresponsive. I want to mention there is a lot we don't know about the kids who are being hospitalized. I've asked these hospitals questions about who is in the hospital, how they're doing. I just haven't gotten answers yet. I'm going to stay on top of this for you, of course, and we'll continue to bring you updates on television and on my social media pages. Back to y'all.